Everybody. So in this video, we are going to focus on the blood vessels and specifically the differences between the arteries and the veins. So before we talk about the anatomical differences and physiological differences, let's just talk about what we mentioned in a previous video, which is the arteries are going to carry oxygenated blood, so high oxygen blood, away from hearts. And then the veins are going to bring low oxygen blood back to the heart. This is just a general way to remember them. The only weird ones are the pulmonary artery and vein. Those are the only two that are opposite. So remember that. Only the pulmonary are the opposite. Now, with that said, there are different layers of the veins and arteries that we're going to discuss because of the different functions that they have, but also a few different structures. For example, right here, right off the bat, you can see that the veins have valves, right? Whereas arteries do not. And then other than that, they do have the same layers inside them. We have the tunica interna, which is on the inside, tunica media, which is the middle, and also the muscular layer, which is a nice way to remember it. So tunica media is middle and muscular. And then lastly, the tunica externa, also known as the tunica adventitia, which is the outermost layer. That said, what are the differences? Right, a lot of words here, so let's break them down. Let's start off with the innermost layer. So when we're looking at the innermost layer of an artery, the tunica intima is usually smooth, and sometimes it may be a little bit rippled during vessel constriction. But another major piece here is the fact that there is an elastic membrane inside. The veins do not have that elastic membrane. So in other words, the artery is a lot more stretchy, right? And that's going to be important because if you think about it, if the artery's job is to carry blood away from the heart, that means they're going to be under a lot of pressure because the heart is pushing blood through all the arteries. So because of that, those arteries need to make sure they're stretchy because if they're getting squeezed with blood all day, it's very important that those arteries can stretch without tearing, right? So if you're not stretchy, it might rip. And if it rips, you're going to start to bleed internally, and that's not good. If you don't believe me that there is high pressure from your heart all throughout all of your arteries, just take your heart rate, right? So if you take your radial heart rate, you can feel the pressure from the heart squeezing up against the arteries in your wrist. So your wrist is very far from your heart, but you can still feel it. Same with your pedial heart rate. You can feel it on your foot as well. Because again, your arteries are under a lot of pressure. So they have these elastic membranes. And that's why if you look at tunica media, you're going to see the same thing, right? Thick, smooth muscle and elastic fibers present, right? In the veins, they're thinner, right? So they're going to be thinner because they're not under as much pressure, right? They also have smooth muscle in them. This smooth muscle is going to be important because for veins, it's the opposite. They're under low pressure. So because veins have low pressure, they need help from these smooth muscles to squeeze the blood back towards the heart. Again, it's kind of weird to think about, but if you think about people who have weaker musculature, like smooth muscle, such as perhaps some elderly patients, you may notice that in some cases people have a hard time getting blood to go back from their legs, for example, back to their heart, right? Because the goal here is that along with your skeletal muscle, these muscles inside the veins help squeeze the blood back up towards the heart, right? So in older people, you may see that they start to retain a lot more water or swelling in their feet or lower extremities. And then lastly, the tunica externa. In this case, it's going to be a lot of fibrous connective tissue and collagen. So elastic tissue and collagen are going to be extremely important here, again, to give it that stretch, but also that strength of the collagen fibers. So these are really strong, well, strong as collagen and elastic connective tissues. If you look at the veins, it's very similar. So in that case, you're going to see that this is actually the thickest layer. And again, it's to give it strength, but also to make sure it helps with overall structure of the artery. Or, I'm sorry, the vein. So the veins and arteries have this for structure. So it's present in both. Let's focus on an artery for a little bit. So if you look here, you can see that the tunica interna, it's going to be smoothish, and then the tunica media is a little bit thicker. So again, it's a much thicker layer here. How many different colors? Blue. It's a much thicker layer of this muscle, right? So it has the ability to help squeeze. And then if we look, where's tunica externa? In this case, again, it has these collagen and elastic fibers as well. Here's another scenario where you see a cross section. Again, you can see these layers. I'll go with like an orange so you can see better here. So you have that first layer, the really small internal layer. And then you have that middle layer. Again, it's a little bit thicker. And then the outermost layer, which is pretty thick as well. Again, it's super important that this elastic tissue is inside the arteries because of how much stretching it has to undergo. All right, so now when we talk about veins, it's a little bit different, right? It's a little bit smoother or smaller as well. So when we're looking at veins, the tunica interna, again, it's small, it's pretty thin. And then when you get to the media, it's very thin as well, right? Again, it's not doing as much stretching. It is primarily just trying to squeeze as much blood back to the heart as possible, but it doesn't need as much tissue as the arteries because it's not under as much pressure. So that's also extremely important. The other thing that we're going to see with the veins is that, again, it's the opening is smaller, right? Again, because of what's going on there. It's the lumen is the opening. All right, opening next to it. The opening is smaller, so this lumen is smaller, and it's not under as much pressure. And here's another really important attribute when it comes to veins. Veins have valves. Okay, kind of like what we talked about with the heart. The heart had valves, right? So why do veins have valves? Let me draw a picture here at the top. So again, here's my example of a artery, and on the right hand side, I'll draw a picture of a vein. Right. So in the case of an artery, it has so much pressure in it that it's able to just push blood throughout the artery. It's just going to push it all the way through because of the pressure. In veins, they don't have that pressure. So because of that, when blood gets pushed, it wants to kind of go backwards in between beats. So every beat, the blood wants to go backwards. To prevent it from actually going backwards, we have valves that are going to be in the veins that will open when the blood wants to move forward, but close off when the blood wants to move backwards. So we do have these valves all throughout the veins to help keep the blood going forward and not coming backwards because it's such low pressure compared to the arteries. If you have any questions on this, just let me know.